Morning. It is so great to see you. Today we're going to be talking about nutritional imbalances. What do you think about when you hear nutritional imbalances? Yes, some good examples are being underweight, overweight, or vitamin and mineral deficiencies and anemia. Right. Which you think is the most prevalent in the US, 1 to 3. Vitamin and mineral deficiencies and anemia, being underweight, or being overweight, including obesity. Actual results are number one, overweight, including obesity, number two, vitamin and mineral deficiencies and anemia, and number three, being underweight. Some medical problems that could cause someone to have difficulty getting enough to eat. So like, for example, if a patient has had a stroke, they might have dysphagia, which is difficulty swallowing. Another example is a malabsorption issue where the body's not absorbing the nutrients properly, such as celiac disease. Some issues we see regarding a person being underweight. Yes, anorexia or bulimia. What's the difference between anorexia and bulimia? Yes, so anorexia is a serious mental disorder, a distortion of their body image. They have an intense fear of gaining weight, even though they're at a healthy weight or less than a healthy weight. Their behaviors include limiting caloric intake, excessive exercise, and obsessive behaviors. And then with bulimia, that involves binging, which is eating excessive amounts of food, and then purging, which is vomiting. They may also use laxatives or diuretics. Now, what age group is most at risk for anorexia and bulimia? Yes, adolescents and young adults. So, I mean, they're a little underweight. Is it really a big deal? Actually, yes, it is a big deal. What are some complications that can arise from anorexia? There's circulatory collapse. It's life-threatening, where the heart does not deliver adequate blood to the vital organs. They can have organ failure, cachexia, complex syndrome um, with weight loss, muscle wasting, and fatigue. They're at risk for suicide, and all of these can lead to premature death. What are some complications from bulimia? Yes, tooth decay from the vomit coming back up, GI symptoms, electrolyte imbalance, cardiac dysrhythmia, and heart failure, and again, death, sadly. Moving away from the mental disorders, here are two types of malnutrition. The first is kwashiorkor. It's when they have adequate calories but a lack of protein, which is accompanied by fluid retention. It can be caused by weaning a baby from breast milk too early without giving them enough protein. And the second type is marasmus. It's severe malnutrition with protein and calorie deficiency. The body starts to break down its own tissues for energy, which leads to extreme emaciation and weakness. Here you can see some pictures of what these people might look like. Both have the thin and brittle hair, but with the kwashiorkor, the one that's just protein deficiency, he has more of a moon face, and then the bulging abdomen, which is ascites. Then with marasmus, he has more of a simian face, and there's a loss of muscle mass. According to the World Health Organization, 45% of the deaths of children under 5 years old are caused by malnutrition. We usually think about this from other places around the world. but it can be seen in vulnerable populations anywhere, including neglected children and older adults. Studies have shown that 31% of Americans are at risk for at least one vitamin deficiency or anemia. People at risk are women, especially of childbearing age, people with low economic status, the underweight, those with poor diets, and even obese people. Okay, we're going to split up into two groups, the left side of the room, the right side of the room, for a trivia game about vitamin and mineral deficiencies and anemia. We're going to start with team one. What is the deficiency in scurvy? Yes, vitamin C deficiency. Okay, and what are some of the symptoms? Yes, swollen bleeding gums, loose teeth, painful stiff joints. Over to team two. What is the deficiency in rickets? Yes, vitamin D deficiency. What are some symptoms? Yes, soft, weak bones, bone abnormalities. Back to team one. What is the deficiency in osteoporosis? Yes, inadequate vitamin D and calcium. What are the symptoms? Yes, bone mass density decreases and bone tissue deteriorates, weakens bones, risk of fractures. Let's go back over to team two. What age group is at risk for osteoporosis? Yes, the elderly, especially women. Still on team two. What are some symptoms of folic acid deficiency? Yes, depression, mental confusion, inflamed tongue, loose stools, decrease in nerve function, and then for the unborn baby, neural tube defects, including spina bifida. All right, back to team one. What is the deficiency in anemia? Yes, iron deficiency, although it can also have other causes such as blood loss, diseases, or medications. And team number two, what are the symptoms of anemia? Yes, fatigue, pale skin, shortness of breath, dizziness, headache, cold hands and feet, and irregular heartbeat. Great job, guys. Now to our most prevalent in the United States, obesity. It's so prevalent, it's considered an epidemic in the United States. Adults age 20 and older, 73.6% are overweight, almost three-fourths, including 40.3% obese. One-third of children in the US are overweight. And breaking down by age, adolescents, over 22% are obese. Children 6 to 11, over 20% are obese. Young children 2 to 5, over 12% are obese. So, how is someone classified as overweight? Yes, a BMI of 25 to 29.9. What about obese? Yes, a BMI of 30 or higher. Morbidly obese. Yes, a BMI greater than 40 or 50% above their ideal weight. Now, I want everybody to get out their phone or computer, and I want you to search for BMI calculator. Let's all use the National Institute of Health one. And I want you to calculate your own BMI. All you need is whether you're male or female, and then you need your height and weight, and it'll calculate for you what your BMI is. So people are a little overweight. Is it really that big of a deal? I mean, what really bad can happen from being overweight? Actually, yes, it is a big deal. Who can tell me some problems that can be caused by being overweight or obese? Yeah, those are some good answers. We're going to continue to talk about some of those in the next few slides. So one thing that being overweight can lead to is hyperlipidemia. So what is that? Yes, elevated cholesterol or triglycerides in the blood. What can hyperlipidemia lead to? Yes, the atherosclerosis, which is a buildup of fat deposits on the arterial walls. You can see a picture of how that is a problem. It's not letting the blood flow through the arteries as well. And so, what can that lead to? Yes, heart attack, stroke, and non alcoholic fatty liver disease. That means there's so much fat in the blood, it needs to be stored somewhere. So, it gets stored in the organs such as the liver, and there's so much excess fat there that it's damaging the liver. Another thing being overweight can lead to is hypertension. What is that? Yes, high blood pressure. What can hypertension lead to? Yes, heart attack, stroke, heart failure, vision loss, renal disease or failure, and erectile dysfunction. Being overweight can lead to type 2 diabetes. So, what is that? Yeah, so a failure of the pancreas to produce enough insulin to regulate the glucose levels, the sugar levels. It allows the excess glucose in the blood and into the body cells. What can that lead to? Blindness, renal failure, neuropathy, which is loss of sensation in the lower extremities, and poor wound healing. So let's pull all this together. Being overweight can lead to hyperlipidemia, hypertension, diabetes, and I put things in color that are in more than one category, such as heart attack can be caused by multiple ones, stroke can be caused by multiple, vision loss, multiple, renal disease or failure, multiple. So, yes, being overweight can cause lots of health problems. How can we help our patients in this area with being overweight or obese? We're going to practice that today. You all are going to get in groups of 2 to 3 students, read the article together, and discuss what stood out to you. Discuss how you would feel if you were the patient in this situation, and then choose one of the patient scenarios. Role play practicing showing empathy, using motivational interviewing, and shared decision making. One person will be the nurse, one will be the patient, and if a third person is present, they can be a family member. Take turns allowing each student to be the nurse in the situation, switching the patient scenarios. These are the references I used in creating the slides. If you have any questions, you can let me know. I hope you all have a wonderful day.